Radio Islam International. The world is our community.
Assalamu alaikum wa rahmatullahi wa barakatuh. This is Faisal Patel, journalist at Radio Islam International. What you see behind me is the entrance to the COVID-19 emergency disaster facility, which has been set up by Gift of the Givers. Now this is a one-of-a-kind facility in the country so far, and it is catering for those that have COVID-19 as the country battles the third wave of the pandemic and also the Delta variant. Now this facility was set up to alleviate the pressure on the country's healthcare system, specifically in Gauteng, because we know currently with the number of infections in the country, there are no hospital beds specifically in Gauteng. So this center was set up. Now Gift of the Givers, Dr. Imtiaz Suleiman said that he wants this initiative to be rolled out across the country to alleviate the pressure on the healthcare system. Now let's understand that this is just an intermediary facility. So it provides you with basic COVID care and also oxygen, but it does not provide high care for COVID-19, which is on ventilators and that sort of stuff. But when we go inside, inshallah, we will speak to the person who's spearheading this particular facility, and that's Dr. Fatima Lambat, and she'll give us more information. But for the time being, this is basically the waiting area. This is where you mask up, where you wear your PPE equipment, your gloves, your hat, and many other stuff. This facility is also run by a group of volunteers. So it's a true spirit of Ubuntu initiative by Gift of the Givers and Nurul Islam Hall and all the other volunteers. Now, in this facility here, where we are at the moment, we're in the kitchen. So you can see this is basically a pause area for the staff that are working in the facility at the back of me. And one of the persons that are doing phenomenal work, among the many others, is Brother Ismail Mayat. He's a procurement officer at the Nurul Islam COVID-19 emergency disaster facility. Let's speak to him quickly. So we are in the green zone of the COVID-19 emergency disaster facility at Nurul Islam, and with me I do have Uncle Ismail Mayat. He's one of the many volunteers that are doing phenomenal work to ensure that this facility is catering and assisting those that are suffering from COVID-19. Uncle Ismail, assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh.
This is the green area, the main facility is at the back of us. That's where all the patients are. But maybe just for our listeners of Radio Islam, what do you do here in the green area?
Gee, the answer is very simple. We've been asked to assist with managing inventory and controlling all the stock. PPE equipment particularly is required on a constant basis, and the idea is to keep stock under control. So that's really what we're doing here for as many days and as long as it's required.
Uncle Ismail, what inspired you to volunteer for this facility?
When you're associated with and you're aware of organizations like the Gift of the Givers and many of our brothers and sisters who selfishly give of their time every day for the khidmat of the deen of Allah subhanahu wa ta'ala, then we took the opportunity to volunteer to do the same thing as did the other volunteers.
Uncle Ismail, we know that we are in the midst of the third wave of the COVID-19. We've got the Delta variant. The cases specifically in Gauteng has gone through the roof. We're sitting between 11 and 12,000 cases. Countrywide, we're seeing between 15 and 17,000 cases. What's your message to the community of Lenasia and surrounds?
Be safe, be smart, and continuously make dua.
Jazakallah. That was Uncle Ismail Mayat. He is working in the green zone of the Nurul Islam COVID-19 emergency disaster facility here in Lenasia. We also had Appa Fatima Mayat, but she doesn't want to come on camera, but she's assisting Uncle Ismail with the procurement and ensuring that stock levels as far as PPE is concerned, masks, these aprons, gloves, medication, and many other stuff is kept up to optimum level. So the people that's working in the facility behind us will have the necessary equipment, the medication to treat those patients with COVID-19. We're now going to enter the COVID-19 emergency disaster facility. We're going to have a look around and possibly speak to Dr. Fatima Lambat, who's spearheading this initiative, which was set up by Gift of the Givers. And also, if there is a possibility, we'll speak to some of the patients to get an idea how they're feeling and also the treatment they are receiving. So let's go in.
Thanks for letting us know your PPE. Because we forgot about this.
All right, we are in the COVID-19 emergency disaster facility. This is the main workstation before we check out the beds. Now there are 20 beds in this facility. 15 are just normal general beds and the other 5 are high care beds. Now you must be wondering what's the difference. The 15 is only low concentration of oxygen and the 5 is high concentration of oxygen. But we will get more detail from Dr. Fatima Lambat, who's spearheading this particular initiative. As I mentioned, that this facility has been set up by Gift of the Givers, which is spearheaded by Dr. Fatima Lambat, and they've basically provided everything that you see in these facilities, from the beds to the oxygen canisters and many other equipment that is needed to treat COVID-19 patients. And for those that are familiar with the Nurul Islam Hall in Lenasia, this is hall number 2. So this is the entrance that you used to see. Okay guys, so COVID is really taking a toll on people, physically and psychologically. We have a patient that has just been admitted to the COVID-19 emergency disaster facility and she is crying. I mean, this is something that has really affected people and the community at large. She is so heartsore and it's really heartbreaking to see her cry because she has to go through this to treat this disease and this virus that is affecting not only South Africa but the entire world and communities at large. I am here with Dr. Fatima Lambat. She's the doctor that's spearheading this initiative by the Gift of the Givers. We spoke a lot about this particular facility. A lot of the equipment that you see here has been donated by Gift of the Givers, and there's a lot of volunteers that are working here. You can see it's quite a busy area, and these volunteers have dedicated their time, their safety. They've left their families to assist those that are struggling with COVID-19. Now remember, the country is in the 3rd wave of the pandemic. We are also battling the Delta variant. And one of the things that I mentioned at the beginning of the video is that Professor Shabir Mahdi said that among the many groups that we have in South Africa, Indians have a 38% chance of actually passing away in hospital from comorbidities because of COVID-19. So this facility plays a very important role based in Lenasia, but let's make it clear that this facility is treating everybody, irrespective of race, creed or color. So it's a true spirit of Ubuntu initiative by Gift of the Givers. So I do have Dr. Lambat with me and we're going to have a quick chat with her. Dr. Lambat, Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh.
First of all, tell us a little bit about this facility. We did get an indication that it's about 20 beds here. Maybe just break it up for our listeners. How are the 20 beds segregated?
Right. So we have 20 beds, 5 are high care beds, 7 are male beds and 8 are female beds. Obviously on the demand we might change that.
Right, now high care and normal beds, right? Now my understanding of high care is ICU or, you know, like we see the monitor there. Define high care for us.
Right. So high care beds means they need increased levels of oxygen. That's essentially what it means. Of course, we cannot have ICU here because we don't have ventilators here, and we're in intermediary emergency disaster facility, right? So essentially, we can give higher flow of oxygen compared to what we can give on in homes. For example, our patient, Mr. Pillay, is actually on 15 liters of oxygen right now.
Now that's the 5 beds, right? And the other 15?
So the other 15 is normal ward beds, right? Essentially, if we put it that way, they will need less oxygen, less than 5 liters or less, and they just here to get physio and to get their IVI medication on time. And as soon as they're ready, they can either go home and inshallah if they get better, if not then they'll get to high care if they need or go to hospital if they need.
Now, if I stand here in the high care area, which
Sure.
this area is,
Sure.
I understand that there's 3 patients here.
Already 3
Right.
patients.
Now you've got 5. What happens if you are overwhelmed by more patients that need high care treatment?
That's a sad thing. And that's why I think that this facility can be an inspiration to many other people to bring about more places like this so that we can help more patients like this. We are hoping in our capacity that we can have a good, quick turnaround time, but we're also hoping that if hospital beds open, they can clear us so we can help a new patient. But if we at capacity, we can't accept more patients, and that's unfortunate.
With regards to the high care, I just want to elaborate on that. So you got 3 patients in high care, right? I don't see any patients on the other side. Would those other beds possibly be changed or converted into high care if need be?
Yes, it can possibly be changed, but we will look at there's a lot of logistics to look after, look at in terms of oxygen concentrators, actual oxygen that we're going to pipe, and as well as our generator capacity. However, we're looking at getting a very big generator by the afternoon, so we're trying to plan for more high care beds.
All right. Coming on to the worst case scenario. So you're giving them 15 liters of oxygen in this particular area, in the high care. What if, God forbid, their health deteriorate to a
Yes.
point where they need to be put onto a ventilator? What happens then?
So unfortunately, during that time, we have to pick it up as doctors, and that is why we're going to have so many rounds, okay? And then what we're going to do is make sure there's an ambulance on standby all the time. We will transfer them there.
All right. Perfect. Can we then speak to you, Mr. Pillay, who's a patient in the high care area? Maybe Dr. Lambert, you can go through the patient with us. Mr. Pillay, good afternoon to you. Thank you for your time. We are from Radio Islam. Maybe just tell us, how are you feeling at the moment?
How were you feeling before you came here?
I don't think you're going to able to hear Dr. Pillay very well. Basically, he's saying that he wasn't feeling very well. He was finding difficulty breathing, if I'm not mistaken, which is one of the symptoms of COVID-19. It does affect your breathing as well. And you can see he's currently on oxygen. This is the high care facility, so 15 liters of oxygen. One of the things that Professor Shabir Mahdi spoke about when treating COVID-19 patients is the importance of oxygen. And why I say that is because remember that India, at one stage, the cases spiraled through the roof because they didn't make adequate arrangements for oxygen to be available in their hospitals. So that is one of the things that is very important in treating COVID-19 patients, which is availability of oxygen. We did show you the stocks that's available there. So the high care area, 15 liters per patient for oxygen.
So in the morning you're doing what you
Dr. Lambert, the monitor on the side, maybe just show our listeners what are the different indications.
So these are the 2 oxygen concentrators that is running to Mr. Pillay, and it is going via a connector here. Hopefully in the week we're going to make a manifold with oxygen cylinders and we will save our oxygen concentrators because that's the plan for the facility. On here we have, this is a high care monitor. Okay, it's stuck nicely. Here we have the ECG readings of Mr. Pillay. We have his blood pressure, which is going to be cycling every 5 minutes, sometimes 20 minutes. And we have his oxygen saturation, which was around 60 or 70% on room A, and now it's 93, 94%. And this is his respiratory rate, which 29 means that he's actually at a lower respiratory rate compared to what he was.
Dr. Lambert, one question with regards to the oxygen. He's on the concentrator at the moment. He's sitting on, I think, 94%, if I'm not mistaken. What was his reading, with his permission, of course, prior to him being put on oxygen?
It was around 70% on room A, and then on about 10 liters it went to 77%. So that's why we needed to put him on a 15 liter concentrator.
And then finally, just on the whole oxygen thing, what is the minimum that the oxygen levels can drop to before it becomes very serious?
So, when a patient is looking at their oxygen, after 7 days, if it goes less than 90%, then that is, okay, 5 to 7 days, if it goes less than 90%, it's dangerous. That is the time when you need to pick up that you're going into the inflammatory phase. And if you can pick up as much patients at that time, inshallah we can give the correct amount of medication, management and treatment, and then patients can get better quicker. The problem is patients are presenting too late, and that's what we want to do.
I just want to put in one more question.
Sure.
You are treating these patients. Obviously, you're going to be overwhelmed by the people, specifically in Malaysia and surrounds, that are coming to this facility. If he's okay and once he's treated for COVID-19, when he's discharged, what happens after that? Do you still check up on him? And
Yes, definitely. All my patients, even when I was working in ICU, even all of the GPs, either the GPs will follow them up and refer back to you, or you try and treat them, because you must remember this is prolonged. It's long COVID, and patients can get better only after like 4 to 6 months. So you must be following up your patients still up until they feel better and they happy to work in their own office.
I'm going to speak to Mr. Pillay and just maybe get a word, and you're not going to hear him, but I'm going to ask him what is his message to those people that are suffering from COVID-19, to the community of Lenasia and to the country. Your message, sir, message that you want to send to South Africans, the community of Lenasia and surrounds. Alright, so basically what Mr. Pillay is saying, he's grateful for all the doctors and the volunteers in this particular facility, and he's also urging the community of Lenasia, surrounds, and South Africa as a whole, because COVID-19 is not only affecting Lenasia and Gauteng, but the entire country. So he's asking everybody to abide by the strict protocols and by the lockdown measures that's been implemented by President Cyril Ramaphosa in South Africa. At the beginning of the report, saying that this is a true spirit of Ubuntu initiative, which has been set up by Gift of the Givers, spearheaded by Dr. Fatima Lambat. Dr. Lambat, the question on many people's minds as we speak now in Malaysia, and everybody that's watching this, obviously the story has gone viral. It was initially written by Radio Islam, and the message is, who does this facility cater for?
It caters for Medicaid. It caters for patients who can up until 20 liters per minute of oxygen, and for anyone who needs intravenous medication. And it is for all Lenasia and surrounds. If we are able to cater other places, we will try and help. And it's for a multiracial, multicultural, zero discrimination. We want to help everyone. We are a rainbow nation, and this is the spirit of Ubuntu, people. This is the spirit of Ubuntu. We will accept every race, every religion, every culture, because we just want to help humanity.
Right. So we are in PPE equipment at the moment, right? And I can tell you that just being here for half an hour is a daunting task. I mean, with the hat, the gloves, the apron, it takes a lot of toll on you, it takes a lot of stress on you, there's a lot of challenges. Your message to the volunteers and to the people of Malaysia and the country?
My message to the volunteers and the people of Lenasia, especially the community, is an emotional one, as we saw last night. I thank you guys for what you guys are doing. Remember that we need to be, a human life is sacred, if I may say. Human life is sacred, and we need to cherish it. Whatever we're doing, even if it's on a voluntary basis, we will get our reward, especially when the people smile. To the people of South Africa, please stay safe, and please can we inspire you, and can we help you to set up similar facilities, these disaster emergency relief facilities. Gift of the Givers, Dr. Indra, Suleiman, and Shinaz Mohammed, they are so helpful. If you can be able to help your guys' community, then please try and set up this facility.
Okay, that's Dr. Fatima Lambat, as you heard. And as she mentioned, Dr. Imtiaz Suleiman said he wants such facilities. This is the first of a kind, by the way. He wants such facilities to be set up across the country. The hospitals are bursting at the seams. You can't get a bed at the moment. So he wants this facility set up across the country so that it alleviates pressure on the health system. Also remember that currently, after doing the statistics yesterday, we are seeing a slight drop in the number of cases. When I say slight, possibly a very slow drop. We were sitting at 20 and 22,000 cases. Yesterday was around 15,000. So we are seeing a slight drop. But that doesn't mean that we need to be complacent and say no, that it is dropping, that we don't have to take precautions. Let us continue to take precautions, because the last place that you want to end up is in a facility like this, where you are going through such difficulty and the doctors that are doing such wonderful work to treat you. So this is the COVID-19 Emergency Disaster Facility, and I want to take this opportunity on behalf of Radio Islam, the community of Lenasia, and the entire country, Dr. Lambat, to you and to the wonderful volunteers here. I think you guys are doing wonderful, wonderful work. And may Allah reward you for your efforts, for your kindness, and going out of your way, sacrificing your time, sacrificing your families to assist those that really need assistance at this time.
Take a walk, live life, but keep Radio Islam International at your side, on air, on social media, 24/7. Radio Islam International. The world is our community.
I find myself in a state of tranquility. Oh.